Speaker, I move to suspend the rules and pass the conference report to accompany H.R. 3230, the Veterans Access to Care Through Choice, Accountability, and Transparency Act of 2014.
Clerk will report the title of the bill.
H.R. 3230, an act making continuing appropriations during a government shutdown to provide pay and allowances to members of the reserve components of the armed forces who perform inactive duty training during such period.
Pursuant to the rule, the gentleman from Florida, Mr. Miller, and the gentleman from Maine, Mr. Mashad, each will control 20 minutes. The chair recognizes the gentleman from Florida.
Mr. Speaker, I ask unanimous consent that all members will have 5 legislative days with which to revise and extend their remarks.
Without objection.
Mr. Speaker, I yield myself such time as I might consume.
Gentleman is recognized.
Thank you very much. Mr. Speaker, I rise today in support of the conference report to accompany H.R. 3230, the Veterans Access to Care Through Choice, Accountability, and Transparency Act of 2014. General Omar Bradley, the former administrator of what is now the Department of Veterans Affairs, once said of our work, "We're dealing with veterans, not procedures, with their problems, not ours." We've come face to face with the problems our veterans routinely encounter, and they are considerable, to say the least. As every American now knows, congressional oversight and whistleblower revelations have exposed widespread corruption, systemic delays in access, and failures of accountability across our nation's second-largest bureaucracy. Thousands of veterans across this country have been left to wait, some for years, some in pain, and most disturbingly, some in caskets draped with an American flag. Some, while chronic or fatal conditions worsened until little hope was left for the health care that they earn through honorable service to our nation. Meanwhile, poor-performing VA leaders and employees continue to receive large bonuses, subject to little accountability for their many inadequacies. There's no doubt, Mr. Speaker, that the Department of Veterans Affairs, as we know it today, is in crisis. And as a result, our veterans are suffering. The conference report we're considering this afternoon is the first step to alleviating their pain in paving the way for the failing VA health care system to experience much-needed structural and cultural reform. To immediately improve access to care for veteran patients, the conference report would require VA to authorize non-VA care to any eligible veteran who is unable to secure a timely appointment at a VA facility or who resides more than 40 miles from the nearest VA medical facility, with certain exceptions. Eligible veterans would include those who are enrolled in the VA healthcare system as of August 1 of 2014 or who are newly discharged combat veterans. It would further require VA to issue a Veterans Choice Card to eligible veterans to facilitate care provided by non-VA providers and provide $10 billion for the newly established Veterans Choice Fund to cover the cost of access to non-VA care under this bill. To lead the way for true reform in the long term, the conference report would require a comprehensive assessment of VA care by an expert independent entity or entities and establishes Congressional Commission to care for who's on care charged with setting the future course for access to and quality of care throughout the entire VA healthcare system. To improve VA's internal capacity to provide timely and high-quality care to our veterans, this report would also provide the Department with $5 billion to hire physicians and other clinical staff and to provide for certain critical fiscal infrastructure improvements. The conference report would also extend VA's rural health care focused Project ARCH pilot program for an additional 2 years. It would extend a pilot program to provide rehabilitation, quality of life, and community integration services to veterans with traumatic brain injury for an additional 3 years. It would authorize 27 medical facility leases across 18 states and Puerto Rico and make certain improvements to care provided to veterans who have experienced military sexual trauma and others. To advance genuine accountability for incompetent or corrupt senior managers, the conference report would reduce funding for bonuses available to VA employees by $40 million each year through fiscal year 2024, and it would authorize the Secretary to fire or demote senior executive service employees and Title 38 SES equivalent employees for poor performance or misconduct. Poor performing employees disciplined under this authority would be provided an expedited limited appeal process, but would be prohibited from receiving their pay or bonuses or benefits during the appeal process. This provision will give the Secretary the tool that he needs to expeditiously hold senior managers accountable for the types of willful misconduct and possibly criminal negligence we have seen during our investigations. The conference report would also require public colleges to provide in-state tuition to veterans and eligible dependents for the school to remain eligible to receive GI Bill education payments. This provision closely mirrors the bill that I offered, H.R. 357, the GI Bill Tuition Fairness Act, which passed the House early this year. The men and women who served this nation did not just defend the citizens of their home state. They defended the entire United States of America. The conference report would also include approximately $5 billion in offsets, with additional incidental offsets expected to accrue over time as a result of increased third-party collections for non-service-connected conditions and reduction in Medicare payments as a result of increased utilization of the newly created Choice Program. Mr. Speaker, the bill before us is one that I'm proud of, but more importantly, it is one that I believe our nation's veterans can be proud of. It's not a blank check for a broken system, but an important first step down a long road toward true transformation. However, our work is far from over. We all know that congressional oversight was crucial to bringing the failures at VA to light, and it will increase in the days and weeks and months ahead after the passage of this bill. The passage of this report will increase access to care and improve accountability with a desperately broken bureaucracy. However, the reform that is necessary to reforming the agency will require dedication for years to come, and I would ask all my colleagues to join me in beginning that effort today. I reserve the balance of my time.
The gentleman reserves the balance of his time.